Hi, I'm Kim Rhoads. I'm the Associate Director for Community Engagement at the UCSF Helen Diller Family Comprehensive Cancer Center. And I had the pleasure of co-moderating a panel at the Rise Up conference this past weekend. The panel was on equitable access to clinical trials, tackling barriers in clinical trial diversity, and really focused on the structural issues that are keeping us from including everybody, not only in participating in clinical trials and getting the best outcomes, but also precluding them from contributing to our knowledge across a diverse group of patients and participants who could potentially benefit from the findings from the clinical trials. The panel initially started with some case studies of different sites that are implementing the I-SPY trial and how they are combating some of the health-related social needs and other structural issues that folks face in trying to get to clinical trials. The second part of the panel was really coming from the perspective of thinking more broadly about the context and the issues of insurance, lack of insurance, the wrong insurance, trials not being available at the location where participants and patients show up for their cancer care, and some of the solutions that are related to that. It was particularly interesting to hear about some of the legislative solutions, in particular SB 37 in California, which is the National Clinical Trials Coverage Act, which broadens the options for people with Medi-Cal to access clinical trials across the state of California at comprehensive cancer centers, where they have a better opportunity of actually getting into a trial for the disease and specific conditions that they're facing. We also talked with Lazarex Foundation, who's providing resources because they're acknowledging the fact that there's not always a clinical trial that is available for people where they show up for care. And then, of course, Tiger Lily Foundation is really working on holding institutions accountable to an inclusion pledge to make sure that structural interventions are being put into place to ensure equitable access for all patients, regardless of race, color, or creed.